Hi everyone, I'm Dr. Andy Wee. I'm an orthopedic surgeon from Singapore. I practice in Mount Elizabeth Hospital and my main area of subspecialty is in shoulder and elbow conditions as well as sports injuries and arthroscopic surgery, also known as keyhole surgery. So rotator cuff injury can occur as a result of trauma or as a result of just wear and tear, especially in the older patients. And this injury can range from mild strain, also called tendinitis, or it can mean a complete tear of the rotator cuff. Rotator cuff injuries are initially treated non-operatively, and this includes several aspects. Firstly, we would recommend a period of rest of the injured shoulder and avoiding activities that bring on the pain. Secondly, we would recommend a short course of anti-inflammatory medications to bring down pain in the joint as well as to bring down the inflammation of the joint. Thirdly, we generally recommend a course of physiotherapy, and how this works is to allow pain-free movement and strengthening up the injured rotator cuff tendons. And last of all, sometimes we would recommend an injection to bring down the acute inflammation of the joint if pain is very significant, at least in the initial presentation. When non-operative treatment fails, we would generally recommend surgery. Surgery is also recommended right in the beginning for certain groups of patients. For example, a young patient with a traumatic full-thickness rotator cuff tear, or when the tear has been long-standing for more than 6 months, and last of all, in a situation where the patient has significant weakness and loss of function. In these situations, we would recommend rotator cuff repair surgery. Essentially, rotator cuff surgery entails repairing the rotator cuff, and fortunately now we are able to do this in an arthroscopic, also called a keyhole surgery. And during surgery, we will achieve 2 to 3 things. Firstly, we will remove any inflamed tissue around the rotator cuff tear. Secondly, we will remove any bone spurs in the undersurface of the acromion, also called acromioplasty. And thirdly, we will of course repair the torn tendon using special equipment to anchor it down to the bone again. So arthroscopic surgery is essentially performing a surgery using keyhole incisions, and during arthroscopy what we actually do is we introduce a camera through a keyhole as well as several minimally invasive equipments into a shoulder joint, and during this procedure we then achieve the aims of surgery. The benefits of arthroscopic surgery is firstly less post-operative pain and less operative stay, and typically arthroscopic surgery is done as a day surgery. Most importantly, arthroscopic surgery is also more accurate compared to conventional open surgery. So rotator cuff surgery can fail for a variety of reasons, and it's important for us to try and evaluate what is the reason for the failure. Typically, we'll recommend repeating an MRI scan, and we'll try and determine what is the cause of failure. If the tendon quality is still healthy, what we would typically recommend is a revision rotator cuff repair, and this can be done in an arthroscopic or keyhole fashion as well. If the tendon quality is poor, then typically on top of just repairing the tendon, we will also use a bioinductive implant that is now available to us. This is essentially a small bioinductive implant of the size of a postage stamp, and we use it and introduce it arthroscopically over the repair site. And the advantage of this implant is it allows faster recovery, and it also enhances the healing of the rotator cuff.